when we talk about what's not depression and bipolar disorder, so you can feel depressed or even euphoric, but BPD mood shifts are often situational and reactive, meaning that we always are able to, or not always, I don't like always, most of the time, we can identify what's called an activating event. This is something happened in your life, like that example I gave just a moment ago. That person's walking out the door and you perceive it as abandonment, rejection, fear, anger, rage, those types of things. So it's situational. So that's what kicked it off. And typically, those mood swings and those mood shifts and perceptions, often they don't last weeks like depression and bipolar episodes. They typically last minutes, hours, and then they sort of settle down a bit. So that's really important. And let me just give you some broader examples. So if you cry after a breakup, that's normal grief. That's normal sadness, right? Normal, expected. I like the word expected better than normal because normal is so confusing. What's normal, right? But expected is like, well, if you have a breakup, you would expect that you would be sad, upset, feel a sense of loss. But if you feel like you have no identity without that person in your life, that's closer and an indicator to BPD.